All right. Good evening, everyone. My name is Mary Ann and I work for Medtronic. Tonight, I have the pleasure of hosting this webinar where you're going to get to hear from Emily with Georgia Urology. Emily is from Georgia. She attended Georgia State University in Atlanta and received her Bachelor of Science degree in biology. She earned her master's in physician assistant studies at Philadelphia College of Osteopathic Medicine in Suwanee, Georgia. And she joined Georgia Urology in 2022 and sees patients at the Canton office. She is dedicated to providing patients with individualized care plans and finds joy in being a PA and is enthusiastic about developing lasting relationships with her patients as we get to see firsthand. Tonight, Emily is going to be speaking on overactive bladder, urinary retention, and fecal incontinence, as well as a therapy called InterStim that helps to treat those. As I mentioned, I work for Medtronic, and that's the company that developed this therapy. While you may not know the name Medtronic, you probably do know someone who's had a pacemaker, and that is what we're best known for. So without further ado, I'm going to go ahead and pass the mic to Emily so you can hear more about this. But a couple of quick reminders before we do that. Everyone has been muted upon entry. So if you have a question, please feel free to type it in the bottom part of your screen at that Q&A or chat function. All of your names will remain anonymous, and we are going to answer these questions following the presentation. So right now, we're going to go ahead and pass everything over to Emily to get started.
Thank you so much for the introduction, Miss Marianne. We are excited to be here. Like you said, my name's Emily. I work in the Canton office with Dr. Ludwig. We see all general urology, but we do a whole lot of overactive bladder. So that's why I'm here today. Yep, she said all my credentials and everything. I also do a little bit of teaching on the side at South College and some mentoring as well for upcoming PA students. So lots and lots of community things, which I enjoy. All right, so let's go ahead and get started. So this presentation, we're going to go through overactive bladder, urinary retention, and like stress incontinence and urge incontinence and what all of that means. These can be really embarrassing for patients to come in and talk about, but I guarantee you're not my first patient nor my last patient of the day that we will discuss these issues with. So you're definitely in the right spot for this. So a lot of patients come to us thinking that this is normal. It's not normal. It's common, but it's not normal. So what we do is we work through a pathway, and we'll go through all of that tonight to get the right answers and to get you the best treatment for yourself, because everyone is different, and we want to treat everyone as an individual. So a lot of our patients come in and just very embarrassed, want to get some control again, get to wear clothes that they want to wear, and get them back to their normal lives. A lot of people restrict their daily lives by staying home because they're not willing to go out in public and risk the potential of either a bowel or bladder accident. All right. So they're not inevitable. A lot of times we think that it's a normal thing of aging, but it doesn't have to be. It's definitely something that we have options to work with. And this is what we're here for. So things like leakage and overactivity and urinary retention definitely have options to treat, and we work through the pathways and get you to the right answer. So 1 in 6 patients in the United States have bladder control issues, and then 1 in 12 also have bowel control problems. So we focus more on the urinary, obviously, but our InterStim program does help with the bowel issues as well. This can cause loss of sleep. So if you're getting up at night a whole lot, that can disrupt sleep, loss of self-esteem, loss of confidence, and poor feelings of general health. If you're always running to the bathroom and you're not doing the things that you want, there's definitely different options for you. So, like I said, we're on the track to get you feeling better and back to your normal life. Some patients come in and say, I just want to be able to wear pants that are other than black. And if that's your goal, wonderful. That's what we'll get you to. But if you want to do a whole bunch of other stuff, that's also great. All right, so what causes the bowel and bladder issues that we see? Daily habits, including what you eat and drink. So things like our bladder irritants. So carbonated beverages, caffeinated beverages, spicy foods, acidic foods, and tobacco and alcohol products are our biggest bladder irritants. They can make the bladder wall rough and just cause you some irritation. So that can give your bladder irritated feeling and send your brain signals that you need to go more often than you might need to. um, Medications and supplements that you take. So some of our patients are on medications like diuretics for their heart. We try and work with that, but the heart comes first. So if you have to take your diuretic, you have to take your diuretic. We just help you maybe delay going to the bathroom as much. That diuretic is going to do what it needs to do and get your fluid off of you. So we have to work with that as well. Other things in our females that we see a lot is pregnancy, so multiple pregnancies, large babies, and trauma during birth can cause a lot of these issues. So a lot of times after birth, we have a little bit of leakage of urine, and then we work you up and see what we need to do. So that's the pelvic floor injury. Um, Pelvic floor injury can also occur in men. Lifting heavy objects over and over again can cause that surgery. So if we have to do like we have to remove prostate, for example, for prostate cancers and things like that, we can have some pelvic floor dysfunction that we have to work with as well. So lots of different components can cause issues with the bowel and bladder. So how does the bladder work? So basically you have your bladder, which is a muscle. It's called the detrusor. It gets about halfway full and it starts sending your brain signals that it needs to empty. And that's when you register, I gotta probably go to the bathroom here, coming up pretty soon. And then when it's the appropriate time, the nerves signal your brain to empty your bladder at the right time. Your kidneys will produce about a milliliter of urine a minute. So that's what we're expecting in just the normal kidney, normal population. Um, but with overactive bladder, the signal kind of gets lost, and these pathways become, instead of straight lines, kind of zigzags. So the Medtronic bladder control device, the inner stem, helps kind of calm these signals down and helps us to make the connection stronger. And we'll go through that more in just a moment. Let's see. So bowel control, the digestive system, you eat, goes through the digestive tract, and as the stool fills the rectum, those stretch receptors send a signal up to your brain. They signal your brain, and then the brain, at the appropriate time, tells your rectum when it's okay to let the stool come out. And so same concept here with rectal or fecal incontinence, then you get kind of these signals messed up. So that's why we are going to talk about this. So stress incontinence. So these are the most common or bladder issues that we see. So stress incontinence, urinary retention, and overactive bladder. I'm going to go through each one of those. So stress incontinence, people see stress and they think, stress, but it's really more pressure on the bladder. So this is your coughing, sneezing, jumping up and down, and having some urinary leakage. That's what the stress means. Um, a lot of people will go work out or go for a run or a walk and have to wear a liner, or they have to change their pants afterwards, and that's what stress incontinence is. All right, so urinary retention is basically the inability to empty your bladder. So the bladder is, there's usually a muscle issue going on. So the detrusor, or the bladder muscle, isn't able to empty the bladder well, and we're stuck with three not so wonderful options. So um, intermittent catheterization, which means we teach you how to catheterize yourself several times a day. This is the preferred of the options just because it's a lower risk of infection. We also have indwelling Foley catheter where you keep the catheter with the leg bag all the time. And then we have a suprapubic catheter, which is the same thing, but it's a surgical procedure to put a catheter right below your belly button to drain your bladder. Um, but now we have this wonderful InterStim system that we can try and see if this can help kind of turn that nerve to the bladder back on, so we can avoid all of the catheters, which is wonderful. So something to keep in mind as well. All right, overactive bladder. So a couple of different parts to this. So urge incontinence. So that is where the pathway where your bladder signals your brain that it needs to go to the bathroom. And then without receiving that okay signal when it's an appropriate time, the bladder starts to squeeze on its own. And as soon as it realizes it's halfway full, it starts to squeeze, and that's when we have the leakage. This can be triggered by really anything, walking by a bathroom, hearing water, washing dishes, anything like that. And then urgency frequency. So uncontrollable urge to go. When the urge hits, you're running to the bathroom, going more than 8 times a day, and then going overnight is a big part of that. So frequency of urination overnight is called nocturia. It's a fancy word for just urinating overnight. And that's a big part of that urgency frequency, can really disrupt your rest overall. And then fecal incontinence, same thing as urinary leakage, where we're having leakage of the stool rather than the urine, and sometimes both. And so this is embarrassing for folks, and they really don't like to talk about it, but um, it can impact your daily life pretty significantly to where you're moderating your activities, not going out, not going to see things or do things that you want to do. But there's definitely options out there. All right, so our pathway is what we are going to talk about. So first, we try lifestyle changes. Is there sometimes people come in and say, I'm drinking 5 monsters a day and I have to go a lot. Yes, that's carbonated, caffeinated, and a lot of volume. So we work on lifestyle changes there. And then we go to oral medications and advanced therapies. So there's a pathway that we go down, and it really helps diagnose each individual patient with their exact problem rather than just using a blanket for everybody and trying medications when they might not work for you or you're not a candidate for it. Um, it really helps us uh, tailor the treatments to each individual patient. So this, if you come into our office for overactive bladder, frequency, leakage, things like that, this is what our sheets look like. So we're going to start with the evaluation. You tell us the story. The top circle is our lifestyle changes, and then we move on to medications. Usually insurance requires 1 or 2 medication trials before we move on. Then we talk again. We might get a cystoscopy, which is a small camera in through the urethra, just to take a look at the bladder and the bladder lining and making sure it's doing all right. Urodynamics testing is definitely included in this, and we tend to move this up, especially if you're coming to us already trying a couple medications, they're not working, you're not happy, they're having side effects, things like that. So urodynamics is a bladder function test, and that is done in our office. Or in the offices around us. A small catheter is inserted into the bladder, and we fill your bladder up with sterile water. The catheter that's inserted is also a pressure sensor, and it tells us how healthy that detrusor of the bladder muscle is, as well as give us any other diagnostic criteria that we may need. So it'll tell us if there's an obstruction, or so like if there's a big prostate in the way. It tells us if the bladder is emptying well. It tells us if um, you're pushing with your belly to empty your bladder. It gives us a lot of good information about the physics of the bladder. That's important because if we're going to move on to these advanced therapies, we need to make sure that you're a candidate for it. Um, so we don't want to, we take the safest route at all times, for sure. So things like Botox and things like that, we have to really consider the side effects and risks for. And then we have PTNS and InterStim that we'll talk about a little bit later. And then on the other side of the screen, you'll see the voiding diary. So we usually like to get a dry, pun intended, um, avoiding diary, meaning that you're not taking any medications, see what your baseline is. And then we'll also probably get one once we start either medication one, medication two, if we're going to do that. It helps with insurance and moving things along that route, as well as we really get good data to see if you're improving or how well you're improving or if it's not really working at all. So it's a good sheet. So this is front and back when you come to the office. So you usually get a couple of them just so you have a couple voiding diaries to fill out for us. So lifestyle changes. So broached on it before, but diet, exercise, bladder and bowel retraining, biofeedback, and pelvic floor strengthening. So pelvic floor physical therapy is definitely part of it, especially for our mamas who's had lots of babies, big babies, traumatic births, all that good stuff. Pelvic floor is definitely going to be involved there. Diet and exercise. So diet, working on those bladder irritants for sure. Exercise, um, getting towards that healthy weight, not having too much pressure on that bladder, and then bladder and bowel retraining. So that looks like, when you realize you have to go, you just try and hold off for just a couple minutes just to try and calm that bladder signal down. Um, a lot of times you guys are already doing a lot of this or have some idea that we need to cut back on some things like caffeine. Yep, everybody drinks a cup of coffee and then has to go to the bathroom afterwards. So a lot of our patients come already doing a lot of these things. Well, we talk through them anyway. So a lot of times we're starting off with oral medications. So medications, we have are good. We have an older class of medications and a newer class of medications. Um, I don't like using the older class of medications just because of the issues that I see patients having with side effects. So dry mouth, blurry vision, constipation, and blood pressure issues. Can definitely play a big part. They have to be taken every day. The constipation can get pretty severe, and any constipation or bowel issues makes bladder issues just a million times worse. So, if you have a history of constipation, I just don't really use them. Um, they in our older or more mature population, they can cause a little bit of confusion and things like that. So we stay away from the older generation medications for that reason. We have two medications in the newer class, Myrbetriq and Gemtesa. They give us a whole lot less side effects, but we still see some along the way as well. So a lot of times patients will have come to us already trying some of the older medications with their primary care. And then we're trying one of the newer meds and we go from there. So, a lot of our patients just it's hard to remember to take a medication, and a lot of times we get kind of sick of it. So a lot of our patients just don't really appreciate the medication option and route. And we see a lot of patients fall off just because that they think that's the only options that they have. So we try when you first come in to really give you a good overview of like, we're going to try this. There's lots of options after this. We're just at the beginning point. That way, all of our patients know that the one medication we try isn't the end all be all for everything. All right, so our advanced therapies. So this is what we would get urodynamics before the bladder function testing done before we do any of this. So we have option. So Botox, it's an injected medication. So it's done in our outpatient surgery center, so you're awake for it. Dr. Ludwig would go in through your urethra where you urinate out of and inject Botox on the back wall of the bladder. This helps kind of slow the bladder from squeezing so much. Calms it down a little bit. So it's working on the muscle portion of the bladder, but not working on the signaling and things like that. So um, it's we have some patients that love it and then some patients that just really don't. The risk with this and why we get urodynamics before it is if the bladder muscle or the detrusor is not strong enough, we run the risk of putting patients in retention until that Botox wears off. So um, not where we want to be. We don't want to swing the other way. Don't go from overactivity to not being able to empty your bladder. So this is a conversation we have with all of our patients just to make sure that we can try this, absolutely, but here's the risk associated with it. This also wears off. So anywhere between 6 and 12 months is usually the lifespan of our Botox injections. Some patients doesn't work for, and then some patients are 2 years in and they still love it. So it's highly variable there. So this PTNM is the next advanced therapy. It stimulates the tibial nerve. So your nerves come out from your back, go around, innervate your bladder, and then travel down your leg. So there's a tibial nerve. It's just behind the inner part of your ankle that we can stick a little acupuncture needle in and attach just a tiny bit of electricity to. This is thought to kind of help the nerves kind of calm down, or the signal to calm down. That way we can turn the nerve back onto that bladder. Um, this is pretty time intensive. But if you're on board, I'm on board. We do this a lot in the office. So it's an office procedure. You come in for 30-minute sessions. The first like initiation period, we do 30-minute sessions once a week for 12 weeks, and then we go to monthly maintenance sessions after that, which is that's why it's time intensive. So you're coming to the office every week for 12 weeks for about 30 minutes, and then monthly after that. And it works well for a whole lot of patients, and it's we don't have to remember take a medication every day. And people can really respond well to it. All right. So our sacral neuromodulation or Medtronic Anderson system, you can see the picture up on the top. Those are the sizes of the implants. This works like the PTNS, but it's closer to the bladder. So it would be installed or implanted right on like the upper hip in your upper buttock area. Um, and the good thing about this is we get to do a trial system before we move forward with any implants. So you'd meet with Dr. Ludwig in our outpatient surgery center. He would put a temporary wire in where the nerve is, and then attach an external battery and put like a big band-aid over your back. And they teach you how to use the programmer. They test out different systems, different sides, and really get to experience what it's like before we move forward with the actual implant. I think that's what patients really like the most, is getting to try it out before we go in and do any major procedure to implant the device. Um, everyone that's gotten one of these has just really done well with it. Um, the implant itself is about the size of like a thumb drive or a USB drive. The bigger one you see is the rechargeable. I think it's the rechargeable one. And we just have such great results with it. This system calms the static from the brain to the bladder, and the bladder to the brain, so you get those more direct and straight lines rather than fuzzy or staticky lines. So if you picture that you're like trying to talk to someone during what's recent? Oh, Super Bowl party. So you're trying to talk to someone at a Super Bowl party. The TV's turned real loud. There's lots of people talking. You can't really communicate really well. That's your bladder and your brain trying to talk to each other when there's static or there's a zigzag line between the connection. The interstim system turns down the volume, so the bladder and the brain, or you and your friend, can talk much more effectively, and just really connect back and forth rather than trying to shout over each other or not have such a good signal back and forth. Um, so that's the best analogy that I can think. All right, so lots and lots of people have had this done. It's like I said, simple test that starts at the doctor's office or outpatient center. That's called our PNE. So you meet with Dr. Ludwig, have the temporary device put in, and get to really test it out. So before you make any decisions, we test it out for about 7 to 14 days, and then you come into the office. Usually, you're meeting with either me or Dr. Ludwig. We're removing the temporary leads in the office, and then we talk about it. Did you like it? Did you not like it? Which side worked better for you? And then you tell us if you're ready to move to the permanent implant or not. So it's a really good system, and we've just had really good results with the trial. All right. A lot of patients ask if this is MRI safe. Yes, absolutely, it's MRI safe. So there's an MRI mode on the controller that they teach you how to use to turn on and off for any MRI procedures. Um, and I think they give you a little card as well. But the device is completely compatible with MRIs as well. Um, So, is this therapy right for you? You have significant symptoms. We've tried lifestyle, oral medications, gone down that pathway. They haven't given you the relief you want. This is the next step. Um, and we have our nurse navigator program that will we enroll you in, and they check in on you pretty frequently just to make sure that you're happy with your therapy, and if you're not, then we're meeting more frequently to make sure that you're getting the therapy if this is right for you. um, so our nurse navigator is great because we'll meet in office. Okay, let's try some Myrbetriq or Gemtesa. And then we schedule a 3-month follow-up or a 1-month follow-up. Well, you get a couple days in, don't like the side effects, you stop the medication. The nurse navigator calls you, they're able to send us a message, and we can bump your appointment up if needed, or we can chit chat on a virtual visit. It's a really good system because it keeps you from having to wait so long to get in contact with the providers. All right, so 84% of patients done in their study really liked it. Really good results with bladder and bowel control. And then 89% of people using Medtronic bowel control therapy experience long-term success. So it's good for the bowel and the bladder. It works the same way with the bowel as it does with the bladder, calms those nerves down. So they're communicating more effectively. And this is the only system that actually works on the nerves itself, and not just to like work on the detrusor or the muscle itself. It says Mitzi. All right, so we have a patient ambassador with us today, Miss Valerie. She's one of my favorites. I miss you, Miss Valerie. I haven't seen you in a while, but that seems to be a good thing. That seems to be a good thing. So if you're ready, we're going to go through these questions.
Okay.
All right. So what was your life like before InterStem?
Before InterStem, on average, for a day, a 24-hour period of time, I would usually go to the bathroom for overactive bladder about 40 times a day. And the part of nighttime that was occurring was anywhere from 8 to 10 to 12 to 20 times at night while I was sleeping. And there have
Mhm.
been times where I was up 30 times in the night, in a 7-hour night of trying to sleep. So you get in the bed, you lay there for 3 minutes after you just went to the bathroom, and you get right back up and you go again because you feel like you're going to wet the bed if you don't get up and go to the bathroom. And when you get
Mhm.
up, you have a teaspoon of liquid that comes out if you're lucky. And then you get back in the bed and you try to go to sleep. And then 5 minutes goes by and you still think you need to go. So
Mhm.
this was my life for a very, very long time, decades, in fact. And I just thought it was normal and there was nothing that I could do about it. And it was just my life. And this is just what I needed, that how I had to deal with it. So if I went out to run errands in a 3-hour period of time and I went to 5 stores in that 3 hours, I would go to the bathroom in every single store that I stopped. It was the first thing I would do, would go in, go straight to the restroom. Then I would shop and leave, go to the next store, go straight to the restroom again, shop, leave, and go to the next one. So it was definitely affecting my life. Being on an
Mhm.
airplane was just as bad. So if you're on a 3-hour flight, you go to the bathroom 8 times on a 3-hour airplane flight.
Yeah.
So that is what it was like before InterStem.
And you're a busy lady too. You're working, right?
Yes, yes. I have a full-time job. I have a little extra side business that I do. I teach painting
Mhm.
classes. I'm always on the go. So, my friends know if they're with me or I'm teaching a class that I'm going to run and hit a bathroom up, and it's just going to happen at all kinds of various times. And sometimes there would be a lot to be voided, like a normal bathroom break would be, and then the other
Mhm.
times you feel such urgency that you have to go, and then it's a teaspoon or a tablespoon. But it's
Mhm.
uncomfortable. If I don't go, I can't actually focus on things because I feel so uncomfortable because I feel like I gotta go, I gotta go.
Yeah. And then how has your life changed since the InterStem?
I would say it's the best way to describe it has been life changing, like massively life changing for me. An
Mhm.
example would be now when I go to sleep, it
Mhm.
is 2 or 3 times in the entire night that I get up. And that is fabulous to me. I think that is the most wonderful thing because I can actually get into deep sleep because I'm
Yeah.
not having to get up, wake up, get out of bed so many times in the night. I
Mhm.
went to Hawaii last summer, and that's a 9-hour nonstop flight. And I only went to the restroom 3 times on that flight. I can
Mhm.
actually sit and watch a movie and enjoy it because I'm not having to
Mhm.
pause it and get up and down all the time.
Yeah. Mhm.
So it has been huge for me because of how much it has changed. I can go into a store and not have to go to the restroom. I can be
Mhm.
out running errands for 3 hours and not have to go at all while I'm out. Clearly, I go before I leave, but before I would have definitely had to go to every restroom in every store, and I don't have to do that now. It's kind of become, a competition now because if I have to be in the car for a long period of time or I have to go to
Yeah.
a meeting, I clearly notice how long I can go now, and I could have never done
Mhm.
that before.
Mhm. Yeah. All right. And then how did you know that this was the right option?
I did not want to take medications because I know how that goes. You forget or you don't do it on the right schedule or any of that kind of
Mhm.
stuff. That was not for me.
Mhm.
And the acupuncture thing,
Mhm.
um, you have that's a maintenance program. So once
Yeah.
you go through that and it works for you, and it did work for me, you still have to go in once a month, every single
Mhm.
month, forever and ever and ever. And that also
Mhm.
doesn't work for my busy, busy schedule and my work life and everything. So to me, it was just a natural choice to do the InterStem implant.
I know I miss seeing you monthly though. All right.
Well,
And how did you
it's been 1 year and a week. It's
That's amazing.
since the implant, and
Mhm.
so I will actually see you in a few months for a
Yay.
checkup.
Good. I look forward to it. All right. And how did you know that it was the right time to try a new treatment?
uh, After 30 years of living this way, it was just not fun, and the sleep deprivation.
Mhm.
I didn't even know how sleep deprived I was until I actually started getting better sleep because I wasn't getting up all the time in the night.
Yeah.
I mean, it just made such a huge difference. difference.
Mhm,
Quality of
mhm.
life was incredible from it.
All right. And what was your surgery like and recovery time?
Surgery was super easy. Everybody that was involved was wonderful and explained everything exactly what was going to happen. It didn't take very long, and it was outpatient, so
Mhm.
I may have been home by lunchtime. Even
Yeah.
it was very quick and easy, and I don't remember having any issues with recovery. I mean, there was nothing that
Mhm,
stands out in my mind. It was just easy peasy. And I
mhm,
have my little controller that I take. So when I travel, I make sure I take it with me. Otherwise, it's at home if I'm in town.
mhm,
But if I
mhm.
travel, I make sure it's packed in my stuff and charged up and ready to go in case I were to need it for something. But it has been wonderful.
And can you talk a little bit about the trial period too?
When I had the temporary for seven
Yeah.
days,
Mhm,
yeah, so that's a little bit different than having the implant because everything is
mhm,
on the outside of your body and it's all taped
mhm,
up with a special tape so nothing gets wet or anything.
mhm,
But I was, you know, I was so wanting to do the implant that
mhm,
doing the trial for 7 days was fine. And
mhm,
I actually did it over Christmas. So
mhm.
I was determined that I wanted to make sure that we could do this and get it done and
Yeah.
make sure it was going to work for me. But I you know, I did I slept a little bit different in the bed because you do have
Mhm,
this stuff attached to you and the device is attached, but it's all taped down. So it's very, if something were to come out, it's next to impossible for that to happen because you have
Yeah.
this industrial clear skin safe tape that is on you to hold everything.
Mhm.
But I I didn't have any problems and I was just so excited. Every day that went by, I was like, okay, one more day down on the trial, one more day closer to
Yeah.
us saying, yes, I can actually have the implant.
Yeah. Yeah. And I think you've done a good job at this one, but anything else that it's impacted in your life?
I just say overall, it's just so much nicer to be able to do things where I'm not
Mhm,
having to worry about where is the restroom, how fast can I get to the restroom. You know, you
mhm,
travel in a car, you don't want to go too long from exit to exit if you don't, you know,
mhm,
because everything kind of revolved around that.
mhm,
Just making sure that you were okay. Were you drinking too much water? Was that good? You know, you get in the car to go on a 4 hour trip and like you don't
mhm.
even want to drink any water because you know you're going to have that's just going to impact it even more. So there's so many things now that I don't have to focus on as much and I don't
Yeah.
have to worry about where's the restroom. I know I have the ability now with the interstem that I can actually hold it. So
Mhm,
if I feel like I need to go, I know I don't have to say we got to stop right now. I
mhm.
can say, okay, there's an exit, you know, that's 15 miles from here. I'll be good to go. And
Yeah.
that has just made such a huge difference because you're not just focusing on it all the time. You
Yeah.
know, you want to
Yeah,
go
for
on a
sure.
hike. If you go on a hike in the woods, yeah, I guess you technically could say the whole woods is an outdoor restroom, but that doesn't work out when you're with your buddies hiking.
True. Very
So
true.
it's nice to be able to do those things and not have to worry so much about, oh, I'm gonna have to run back to wherever the restrooms are at the park or any of that kind of
Mhm.
stuff. It is just it's absolutely wonderful.
That's awesome. That's awesome. I'm so glad it worked so well for you, Miss Valerie. Thank you for coming on. I really appreciate it.
Sure, sure. I'm glad that I can let everybody know. And I do tell people all the time, if you meet me randomly, I might have a discussion with you about this
Yeah.
because
Mhm.
I was unaware of this technology and had just lived with this problem with overactive bladder for a very
Mhm.
long time and way too long and did not know this existed. So when I found that out and I started seeing Emily, it was just the best thing ever.
That's awesome. That's awesome. Yep. All righty. Well, thank you again, Miss Valerie. I look forward to seeing you in a couple months.
All righty, thanks.
I
Okay.
do want to go ahead and point out this QR code. There is the one that says scan me is directly to Emily that will go to the scheduling portal. And this is going to be the fastest way for you to get an appointment with their office. The call centers really get bogged down, and this has been set up so that we can open availability sooner than you'd be able to by just going to the website or calling. So we'll leave that up for a minute while we close things out. Emily, thank you so much for hosting this. We
Yeah,
are
for
so
sure.
appreciative. It is incredibly informative, and we're just really grateful for your time. And Val, thank you so much for getting on and sharing your story. It really, like I said, it is one of the greatest things to be able to hear from a patient who's been impacted by the office that you're dealing with. And it's a rarity, but it's so great to have someone like Val who also is so active and has such a full life to be able to hear from her and hear how this has really changed her for the better. So we're just very grateful for both of you for doing this.